Hey everybody, Buckminster this morning over here at Louisville Physical Therapy with Jay Becht. Jay, good to meet you.
Good to meet you.
Really been fun to kind of take a tour of your facility this morning, learning a little bit more about what you guys do, but I want to hear it from you.
Sure.
I know you guys specialize in helping folks get their quality of life back.
Absolutely.
Meaning once they've been hurt, had it been in an accident, or just, you know, something's just not feeling right or working right, you help them with that.
Absolutely. Everybody comes in. Usually people have pain. Sometimes they just can't move a limb the way they want to move, or they can't do their job the way they want to do it,
right,
or they're struggling with something at home. So our job is to identify that issue,
right,
and treat it and get their life back to where they want it to be.
Very good. Now, if I'm in an accident, I know I have been in my life, and several of them, but I know that I don't always feel hurt after the accident. But then a week, a month later, after I've already been to the doctor and maybe he gave me a prescription to, you know, help me relax or whatever, then I feel the pain.
Right.
Yeah. What is that?
Well, a lot of times right after an accident, especially a car accident,
right,
your body has this adrenaline rush.
Okay.
And that can really mask the pain that you're having. So you're not really focused on that at that point.
Okay.
Then your body gets some time to kind of react to that accident. The adrenaline goes down, and then the inflammation from the injury actually starts to cause you to have pain.
Wow.
And then, you know, of course, the pain can persist after that.
Right.
And if you don't address it at that problem, they can turn into something that's much worse than what it would have been if you didn't get it treated sooner.
Right. And so many times I think what we find ourselves doing is just treating that pain with a rub of some sort that you buy at the drugstore, and the inflammation with maybe a prescription, and so we're just kind of band-aiding it. Maybe those are my words, not yours, but
well, a lot of times I think if you give the body the opportunity to heal, it will heal itself.
Gotcha.
And many people get better without treatment,
okay,
but we're treating the people that don't.
Right.
And obviously there's a large number of those people. If the body doesn't heal properly, then there can be some adaptive changes that occur, some weakness, some tightness, which impede the ability for the body to function. And that's what our goal is to identify those problems and to treat them specifically so you can get back to what you want to do.
Awesome, awesome. And I know a lot of doctors refer their patients to you. If I was in an accident or, you know, something happened, would it be important if my doctor maybe didn't recommend physical therapy for me, maybe to at least inquire with them about that or ask them about that?
Absolutely. You can inquire about doing treatment, doing physical therapy. In the state of Kentucky, you don't actually have to have a doctor's referral in order to be seen.
Okay. All right.
Some insurance companies require that in order to reimburse for our services, but not all do.
Okay.
So you can, you know, if you have a problem, you can come and see us. We do have a free screening program here as well that will allow you to come in and spend 15 minutes with a therapist and let us do an assessment and see if you really do need some therapy or if you can get by with just doing some things at home.
Okay, so free screening, free assessment, and if I was in an accident or injured or possibly thought my insurance would cover it, now is that something you or somebody on your staff can help me with? Because dealing with insurance companies for me has always been a challenge. You know, I'm on hold forever. I don't know really what to say. I really don't know process of getting them to look at my situation. Is that something you guys can help me with?
Absolutely. That can be a really complicated issue. Our front office is very good at dealing with insurance companies and kind of taking you through the process of how to get all of that straightened out. It can be challenging, but we deal with it every day, and like I said, our office staff does a great job.
Right. Well, what I'd like you to identify for me now are some of the more simple issues that can turn into bad issues health-wise that you could help me with, like right away, and then what are some of the more, what are some of the toughest problems that you wind up helping people with?
Well, I'll tackle the toughest problems first.
Okay.
The toughest problems for us to deal with are the chronic pain issues.
Okay.
Things like degenerative joint disease or degenerative disc disease, or somebody that's injured themselves 20 years ago and now they've had kind of off and on problems, but they've developed some arthritic type changes that can go along with that. That's difficult to treat because it is a chronic type problem, but it can be helped. it may not necessarily be cured,
right.
but it can definitely be helped, and the quality of your life can improve if you address those issues.
Right, meaning you can help eliminate some of that pain.
Eliminate pain, improve mobility, improve strength. You do those three things and your function automatically gets better, and you have a happier life.
Right, and I know that when we take the tour of your facility here in a minute, you're going to show us some of the things that you can use, that you would use out there to help do that, right?
Sure.
Very good.
Absolutely.
And what about that first question? Are there some things that, that don't seem bad for the average person like me now, but they could get worse if I don't get them treated or cared for?
Absolutely. Any kind of minor sprain or strain can develop into something that becomes a bigger issue if you don't address it. I alluded to earlier that the body is designed to heal itself. We're engineered to heal,
right.
But we do need to assist the body in doing that. And if you don't address those problems early on, then a bigger problem can arise. I'm thinking just right off the top of my head, an ankle sprain can become a chronic issue, and we deal with a lot of students and athletes that come in that have had an ankle sprain, didn't address it initially, and now they're having this chronic nagging type pain. If they would have addressed it sooner, then there's a good possibility that they wouldn't have the chronic nagging type pain.
Right. And what about headaches? I know that, in my life, whether I was a kid and fell off of something or an adult and was in a car accident, it seemed to always be followed by headaches that just continued for a long time. And I wound up treating it, with over-the-counter medication and stuff, but the headaches never seemed to really go away for a long time. Is that something you can help me with?
Absolutely. Headaches and neck pain go hand in hand. A lot of the smaller muscles that attach from the neck to the skull in the back of the head get really tense and tight whenever you're in an accident or whenever you have stiffness in your neck, and that is usually what causes the headaches. And there's a lot of physical therapy techniques, manual therapy techniques, mobilization techniques that we can do that will really address that headache.
Very good.